Hi, welcome to the Beauty Authority. I'm Tatiana Bido, Director of Aesthetic Content. And today I have with me Dr. Doris Day, celebrity dermatologist and NewBeauty Top Doctor.
So great to be on with you.
Menopause is such a big topic right now. Why do you think it's finally getting the attention it deserves, especially in the beauty and aesthetic space?
There's been a great lag in when we started the conversation to when it's picking up steam. I've been talking about it for close to 20 years, and it's about time that the conversation picked up. I'm not the only one talking about it, but enough of us have switched that momentum where we've been reading the actual data instead of the headlines and conclusion. We haven't been towing the party line about the safety of or harms of hormone therapy, or menopause hormone therapy as it's now called. And we're helping women understand that this is a special time of their life. There's a misconception that when you're a teenager, you get your period. When you hit your 50s, you go through menopause, as if those are equivalent, and they're not equivalent. Getting your period is a sign of maturity and fertility, and that's something positive that you go into. Menopause is a sign of decline, and it's a pathologic process, but we don't call it a disease because all women go through it. And women were misled into thinking that just because we all go through it, it's normal. It's common, but it's not normal, and it's not okay. And we do have science that can help us deal with it so that we don't have to take that ovarian failure and that lack of hormone and hormone balance as just a part of life that we have to power through or live with. We can treat it and live our best lives as we hit this important time in our life, because we're living longer. Now it's about living healthier for longer.
It's so funny. I was going to say it's just a part of our lives. It's such a cliche comment that you hear so much, and you feel like you just have to live with it. We also are seeing so many celebrities coming out right now. Naomi Watts has her line Stripes, and Halle Berry has Respin. Is it helping move the conversation forward to have notable women like this talking about it in the public?
Celebrities definitely influence, and they drive conversations, and they sell. So having a celebrity speak out about something will definitely elevate the conversation and make it more comfortable, especially when you have women as beautiful as these two women. So Naomi Watts, Halle Berry, they're beautiful, they're aging well, they're telling honest stories, and they're sharing their own personal stories. And this really does help other women feel more comfortable, because they're not overdone. They're not ones to buy into everything. And at the same time, they're telling you stories that we can all relate to. Anybody who's been through all of the things that we go through around perimenopause and menopause will relate to the same stories. But what's interesting is that so many women don't tie it to that, because the symptoms are so broad and so nonspecific that, and we've become so specialized within medicine that every doctor can handle their symptom, whether it's frozen shoulder or joint ache or hair thinning or rashes or breakouts or GYN issues or joint issues. All those things are signs of hormonal failure and hormonal imbalance that are so nonspecific that we can just attribute to, I'm just getting older, or my brain fog, or my heart issues, all of these things. But when you tie it together and you ask the questions, you realize that, wait a second, we have a unifying diagnosis here. That is perimenopause and then menopause. And if we address it early, we can minimize some of the degradation that goes with it so that we can really stay healthier for longer.
Well, it's so confusing too, because I'm 47 and I'm not sure where I'm at. Am I in perimenopause? Am I in menopause? So what are some signs that can help you understand where you are? Or is there a test that I can take?
Yes to both. There are tests. You can look at your estrogen levels and your FSH levels. And when you hit about 25 in the FSH level and your estrogen starts to drop, then you know that you're at perimenopause. A simple way without a test is when your periods become somewhat irregular. That's a sign you're entering perimenopause. Softer signs even, because sometimes people don't notice that. They say, I still get my period every month. But then they have things like, I am more irritable, or You know what? I wonder, am I more bitchy or are people more stupid? Like, my see, people who laugh at that are going through it. When I say this to my younger patients, they don't get it. So if you get that line, you're in perimenopause. And then there's things like I'm breaking out like a teenager again, or my hair is thinning, or the sign that I see so universally is women will come in somewhere in their 40s and they go, one day my face just fell apart, because you do have accelerated collagen breakdown from that estrogen depletion. And when you're in perimenopause, when you're at perimenopause or you're going through perimenopause, what happens is that your eggs are starting to run out. And some months, 2 eggs might go in, some months, no eggs might go in. That's why your period's off. It could be lighter, it could be heavier. And that's a great hormonal fluctuation. When you're in perimenopause, one of the universal things I hear women say is, one day my face just fell apart, because your collagen loss and degradation accelerates during this time. You have your decades of sun exposure, stress, inflammation, inflammaging, all those things that are already targeting and sort of piling up and adding to the collagen breakdown. And then you have estrogen depletion, which is really important for collagen production. So you can lose up to 30% of your collagen in the first 5 years post menopause. And women really feel it before anybody else sees it. So that's one of the signs that I see, along with itchy skin, dry skin, breakouts, increased infections, increased UTIs. All of those are signs of estrogen depletion that comes with perimenopause and menopause.
If my skin is drying out and I'm having these types of symptoms, is it still safe to use retinol during this time?
Absolutely. But I think if you look at what retinol does, if you look at the prescription form, which is retinoic acid, this is what's called an abundance mimetic, meaning that it acts as if your skin, everything is going so well that now it could do all this housekeeping, build up collagen, do all those great things. But if your skin, if your fibroblasts, the collagen making cells are exhausted, and the mitochondria that produce energy of those fibroblasts are exhausted, they can't build collagen, and you can end up with irritation and thinning of the skin. So once a woman hits perimenopause and menopause, I tend to dial back the prescription strength and switch more to the over-the-counter retinols and retinoids that are precursors of the active form, and then mix that together. So just a few days a week, sort of deciding per patient how to use them together, but switching really more to the not prescription forms. And those also have added antioxidants and hydrators that are supportive of skin barrier repair and even wrinkle repair and redness reduction. So it's definitely a combination of prescription and non-prescription forms, and then combining exosomes, antioxidants, peptides to help with the barrier and overall skin quality.
So, just to break it down even more simply, if I was going to the store and I wanted to purchase skincare for this phase of my life, what should I be looking at? What should my routine consist of?
Gentle cleanser. And then if you want to add in a glycolic acid cleanser, that's fine too, but maybe not every day, depending on how dry or oily your skin is. Then in the morning, I do like vitamin C because I think it has added value against UV damage and pollution damage. You want to up your sunscreen game, so make sure you don't just use it in your moisturizer, but use a true sunscreen. And the difference is that if you have a moisturizer that has SPF, yeah, that is an SPF. It is a sunscreen, but you're not going to use enough to get that true SPF protection. So you can use that, but then you also want to layer on a true sunscreen that's not necessarily a moisturizer combination by design. So you get enough of a layering, and then reapply it more often. So protecting against UV damage to your neck and to your face is really critical, because you just now are in the preservation phase. And then in the evening, use a gentle cleanser or glycolic acid cleanser once in a while. Exfoliate maybe a little bit less often because your oil glands are less productive, but the skin cells may not naturally exfoliate as well. And if they pile up, that can make your skin look dull. Then you can use an antioxidant serum, then a retinol, a prescription one every second or third day, and a retinol that's over the counter every day altogether, and then a moisturizer on top as you need. That's
And
it.
what
Simple. Few steps.
about just a few steps? And what about our hair? I feel like there's so many factors that can lead to hair thinning, but aging is one of them. And going through menopause, I think it takes a hit too. So can you explain that? Should we be taking supplements? What should we be doing?
Hair does naturally age. So even if you don't have a genetic pattern of hair loss, which can be accelerated around perimenopause, you can just have natural hair aging, which means your hair becomes finer. Each strand becomes finer and the overall density can be less. We always notice it more in the temples, and they're called the temples because they're the first place to show time. So everyone gets a little bit of thinning in the temples, and it offends everybody, and it really puts some people into a panic. Minoxidil seems to help topically, even for hair aging, because it seems to improve blood flow to the scalp and may help hair stay in that growing phase called the anagen phase for longer. And so it can help the hair you have actually get thicker. And in their clinical trials, women using the 5% once a day, 80% had hair growth responded, and then the hair that regrew was up to 50% thicker. So I look at it as anti-aging for the hair. And then there's other things like peptides that you can use. Carifactor is a good brand. There's other brands out there that I also like. And the supplements can be helpful. Nutrafol is an excellent product. It has, considering it's not a drug, but it's a supplement, it has good data that shows that the ingredients they picked and the way they're sourced do actually work. Not everything works for everyone, but that's a good supplement for many people. Some people don't like that it's 4 pills, so I tell them take 2. Like, taking anything is better than nothing. So whatever you'll take will add some value, but it's designed for 4 pills a day. And then there are things like PRP and the hair growth lasers that do help. And everything in combination does even more than just one thing by itself, because each thing works by a different mechanism of action and can support the others. And the earlier you start, the better, because it's easier to not lose hair than it is to try to grow it back.
And what about HRT? You mentioned HRT at the top of our conversation. And a few years ago, it seems like everyone was saying, don't ever do HRT. There's a huge cancer risk. And now it's back in the spotlight. What forms of HRT are available? Should we be using them? And why the disconnect between now and?
Well, that's something that I've been trying to preach for a long time. I would get scolded by colleagues who were telling me that it was out of our frame and that I was spreading cancer by even talking about it, which, I mean, I could see that you can have a discussion with someone who's read all the data. But to say things as a physician, especially when you haven't read the actual studies and the data, and then to make other people feel bad about it, is where I have a problem. So a lot of the doctors who are saying don't do hormone replacement, what they're not saying is what happens if you don't do it. So they're worried about the risks of doing it, which are incredibly low, but the risks of not doing it are very high. So the risks of not doing it are heart disease. It's things like hair thinning, skin becoming finer, increased bruising, brain fog, joint aches, osteoporosis. So we know that if you look at just estrogen alone, in their studies, there was no increase in breast cancer, and there was a lower risk of uterine cancer. So the protective effects of estrogen are there. You add in progesterone, especially if you add in progesterones, not progestins, there doesn't seem to be a significant increase. I think it's less than 1%. And what we've come to understand is that when you use the bioidentical estrogens that we have delivered without going through the liver, avoiding that first pass metabolism. So whether it's sublingual or through a patch or a cream or a vaginal ring, the amount of estrogen is 10 times or more lower than the estrogen in the pill. Women have been taking hormonal contraceptives. They take it for decades and decades and have no issues with it. But then when it comes to hormone replacement or menopausal hormonal therapy, all of a sudden they're in a panic and they say, I can't do that. And I think it's just misinformation and outright lies. Estrogen is not a carcinogen. And there are safe ways to do this. And you can do testing. You were asking about that before. You can measure your estrogen levels and you can adapt it, but mostly you adapt to symptoms. So when you restore, then you can say, okay, well, I feel good now, so I'll stay at this level, or you can adjust it. But I think the 3 that need to be replaced is estradiol, and that's transdermal or mucosal, which avoids the first pass metabolism by the liver. And that doesn't have that same risk of strokes or migraines or other issues we worry about with oral estrogen, although some people still need the oral estrogen, but that's not where I would start. Then I would do that for a couple of months or a month or two, and then add progesterone. And that's progesterone by mouth, about 100 at bedtime. And most women, it helps with sleep. So you'll notice a dramatic improvement in your sleep quality and the amount of sleep you get a night. And then once that's established and that's settled and your numbers are good and you feel good, then I would add in testosterone. Because what happens at perimenopause is that your estrogen declines and your estrogen receptors decline as well. And when you supplement those, that can also knock down your testosterone more. So you often need to add testosterone. Now, when you add estrogen, you often feel better within a day. When you add progesterone, you often sleep better within a day. When you add That's from progesterone. When you add testosterone, it can take a month or two to really feel the improvement. And then we get a lot of questions about topical estrogen for wrinkles and skin quality. Yep. So I figured I would go there. So topical estrogen, there's some studies, but not a lot. And there's no FDA approved topical estrogen that is made for skincare. So people usually use vaginal estrogen or they compound it, and it's usually either estriol, which is the weakest form of estrogen, or it's estradiol in a much, much, much lower concentration. So if we're using 0.05 or 0.1 for hormone replacement, we're using 0.01 or 0.03 for the topical, and really just on the face and neck. So now you have two types of estrogen receptors. You have beta and alpha receptors. On your face and neck, you have the highest density of beta receptors, estrogen receptor beta, than almost anywhere else in the body. In your breast and reproductive tissue, you have estrogen alpha receptors. When you use estriol, it selectively binds to the beta receptors. And if anything, it might even knock off some of the estrogen from the alpha receptors. Not saying it's protective, but it certainly doesn't add harm. So I think if you're going to use topical estrogen anywhere, the face and neck are a good place to put it. And then vaginally to help the vaginal mucosa and prevent UTIs, which is a big cause of morbidity for women. And it's an area that we treat as dermatologists. I do a lot of the carboxy vaginal mask for women for UTIs and for
The
vaginal
CO2
health.
lift.
The CO2 lift, I think
Yes.
it's great,
Yeah.
both for the skin and the vaginal treatment as well.
And what benefits can you expect to see if you do start using topical estrogen?
It's hard to say. I mean, maybe there's a decrease in the breakdown of collagen. I think that the changes are probably slow, and I don't know that it really does a whole lot. It's been around a long
It's not
time.
a miracle worker. It's
No,
not going to turn
no.
back the clock 20 years.
Yeah, because the reality is you might not have the same receptors that are active. But I think the younger you start, the better. The younger you start hormone therapy, the better. The younger you start the topical estrogen, the better. Because when it's easier to prevent a problem than it is to fix it after the fact. So if you start your hormone therapy before you have that collagen breakdown, you're not having to repair and build back as much. You're just slowing down the breakdown. Unfortunately, none of this stops aging altogether. It just makes it go a little bit slower as I'm learning, but but it does add value. And certainly in terms of overall health, when you look at all your organ systems together, you realize that estrogen is such a critical organ for general health. You see it in your skin, but we now know that your skin isn't just reflecting your overall health, it also affects it. And keeping your skin healthy helps your other organ systems as well.
Well, wonderful. I think there's so much more we could talk about for another hour, hour and a half, because I have so many questions, as do so many women that are going through this. So thank you so much for your time. I think this helps shed a little bit of light on what we should be doing, what we can be doing, and just knowing that we're not the only ones going through it.
Absolutely. I'm really, this for me is a focus of longevity beauty. And I always think of the line my dad said is that we should all die young at an old age. And when you do things like follow science and you do the lifestyle actions with it, you start lifting weights and doing the right exercises and lifestyle choices and focusing on your social circles and understanding that your beauty is different, but it's it's special and it's all there. It's just different than it was when you were in your 20s or 30s. Then you realize that this can be the best time of your life and you can live your healthiest from now into your 90s and even hundreds. So my goal is to help women get there and understand that they have control. And there's so much that we can do.
Wonderful. Thank you so much, Dr. Day. You're always helping us look better and feel better. So I knew you were the perfect person to talk to about that.
Thank you.
Thank you. Have a great one.